Hi, my name is Stephanie Hertz, Marketing Director at Warwick Forest. Warwick Forest is proud to be the premier sponsor for CNU's Lifelong Learning Society, and we welcome you to the Riverside Lecture Series. Today's speaker, Denise Butler, holds a BS in Psychology from Old Dominion University, an MS in Counseling from Long Island University, and is currently pursuing a Master's in Dementia from Hull University in the United Kingdom. Denise began as a volunteer at the Riverside Center for Excellence in Aging in 2011 in the Geriatric Assessment Clinic, and in 2013 became the clinic coordinator. In May of this year, she became a geriatric care specialist. She's a certified senior advisor and trained facilitator in caring for you, caring for me, chronic disease self-management, received training in the New York University Caregiver Intervention Program, is a certified trainer for Teepa Snow's positive approach to caregiving, and is also a certified consultant for Teepa Snow and an advanced consultant for Teepa Snow. In February 2016, she and other volunteers in Williamsburg began the Memory Cafe to provide a socialization opportunity for people with dementia and their caregivers. She's involved in the Purple Flower Project, which provides dementia education and skills to hospital staff. And she recently received the Southern Gerontological Society's Victor W. Marshall Fellowship in Applied Gerontology Award. Ms. Butler's interest in and dedication to geriatric health came from personal experience with family and friends. Please welcome Denise Butler as she speaks about memory loss, what's normal and what's not.
Okay, so what we're going to be talking about today is normal versus not normal aging. And this is from Teepa Snow, and that is a picture of Teepa up there. Somebody asked a question, where does she get her name? I didn't know this for years, but about a year and a half ago, I got the answer to that. And that is when she was growing up, somebody in her neighborhood became trained to work with children with disabilities. And he recruited kids in the neighborhood, including Teepa, to work with these kids. Her name is actually Terry. The kids couldn't say Terry. They started calling her Teepa, and it stuck. So that is how Teepa Snow got her name. So she's all about the positive approach to care. Her motto is until there's a cure, there's care. And the mission statement is to develop awareness, knowledge, and skills with all people to transform what exists into a more positive dementia care culture. And so it's changing dementia care one mind at a time. So you're going to see a couple of videos with Teepa demonstrating normal versus not normal aging. I have to warn you that her language gets a little colorful at times. So just so you're prepared, my language will not get colorful.
What we're going to talk about now is the difference between normal aging.
Everybody can hear that, right?
Now, understand, I did not say dementia. I just said normal aging, not normal aging, because one of our big misconceptions in this country is that if it's not normal aging, it's going to be dementia. And that's not true. So we've got to get that one off the table. So what I'm going to do very quickly is give you two quick little role plays that are going to take you through normal versus not normal. So I'll do normal first. I'm in the living room. And I've been watching a TV program, and the program finishes, and I decide, you know what? I'm thirsty. I think I'm going to go make a pot of coffee. And I head toward the kitchen to make coffee. But before I get all the way in the kitchen, the telephone rings. And so I answer the telephone. Hello? Oh, hi, sweetheart. How have you been? Well, yes, of course I know who it is. It's right on the tip of my tongue. Starts with B. Betty. Of course it's Betty. Sorry. Recognized your voice right away, just couldn't think of your name. Yeah, senior moment. Huh? What? Oh, no, I'd love to get together. Oh, today? Okay, what? At 2 this afternoon? All right. Oh, at the mall. Okay, well, which end? Macy's. Oh, that's where JCPenney's was, right? They moved out and then I know what you're talking about. Absolutely. Hmm? The menswear, is that the same? Yep. I know where to be. 2 o'clock, I'll be there. Mhm. Wait right inside the door. I'll be waiting right inside that door. It's supposed to be a little chilly this afternoon. Yeah. Huh? What? Oh, they opened a new chocolate store. Oh, well, you know me. You know what I'm gonna get. I'll get caramels. I always get caramels. You're gonna get. I know you like the white flaky stuff in the chocolate. Yes, coconut, of course. That's you. Huh? Oh, no, I'll be happy to call and see if Margaret wants to come. That'd be great. Yeah. Oh, the vacation pictures? Yeah, I'll bring them. Wait till you see yourself in that bathing suit. Oh, I was just kidding. Just teasing you. You know how I am. Such a teaser. She's getting fat. I'm not going to say it, but she sure is getting fat. Okay. Huh? What? No, I didn't say anything. I was just talking to myself. Writing a note. All right, sweetheart. Well, I'll see you then. Love you. Okay. Bye-bye. What did I come in here for? Okay, hang on. Let me think here. I was in the living room. I was watching the TV. Program ended. Oh, if Betty hadn't called, I'd been able to remember. Okay, let me think on this. Nothing here. Okay. I was in the living room. I was sitting right here. Okay, and the program ended, and I thought, man, okay. Coffee. Why could I not think of that? Lord knows I'm losing it. Now, all of you've gone dead silent because all of your brains are going, oh shit, I've had this. Every single one of your brains is going, oh my God. Oh my God. And your brain is going, that's not dementia. That can't be dementia. I don't think that's dementia. That's just normal. Isn't that normal? I think that's normal. Your brain is talking to itself. One side is going, I think you've got, she didn't say that was dementia. I think she said that was just not normal. I think that was okay.
I saw a lot of laughter and a lot of like a lot of nodding. Oh yeah, I've done that. Everybody's experienced this. This is normal aging. We're going to talk a little bit about that. So there are kind of 7 different types of memory loss as part of normal aging. One of them is transience, and you kind of forget facts over time, all the details, but you will remember the event. Sometimes you can kind of get little dates and things confused a little bit because they were very similar. Normal aging, don't get excited about it. Absent-mindedness. Who here hasn't had those moments of being absent-minded? Raise your hand. We all have. Okay. Blocking. So what's blocking? Blocking is when somebody asks you a question and it's right on the tip of your tongue. You know that answer. Okay, so that's normal. It's that temporary inability to come up with something. When do we remember it? 2 o'clock in the morning. Misattribution. That happens when you remember something accurately in part, but you forget, you attribute some of the details to a different event, like a time, place, or person involved, and you'll say, oh, I'm pretty sure you were there. It's like, no, I wasn't there. That's normal aging. Suggestibility. We all have that vulnerability in our memory to the power of suggestion. Somebody suggests you might have been at a time and place, and you kind of go, I think I might have been there, even if you weren't. Normal aging. Bias. Even the sharpest memory isn't flawless snapshot of reality, right? So your perceptions are filtered by your personal biases. How many of you been to a party with somebody and then the party's over, you go, I had such a good time. And the other person looks at you, I don't know what party you're at because I did not have a good time. That's when that misattribution, that bias comes into it. And persistence, how many of us worry about forgetting things? We all do. But in some cases, forgetting a memory is actually a good thing. It helps preserve us. People with PTSD would like to forget some of the things that happened to them. So some of these memories are accurately reflecting something that was pretty horrifying that happened to you. And others may cause some negative, maybe a negative distortion of that reality. This is normal aging. How many of you parked your car in the lot, forgot where you left it? You know what happens? So here's the difference between normal and not normal. I go to the same Harris Teeter. I know, how many of you always park in the same place mostly? Yeah, it's our comfort zone. So what happens on the day when you go to park and that spot isn't available and you got to park a couple of rows over and you're on your phone, you're not paying attention. You go in, you get all those items on your list, which you're proud you remember because you don't need a list. You've got a mental list up here. And you walk out with your cart and go, huh, where did I leave my car? Because you weren't paying attention to where you parked. You're on autopilot. Autopilot takes us back to where we always parked. Normal aging. Now, my fear is to be one of those people in the parking lot wondering if the cart and somebody's going to call the police because clearly this woman has no idea what she's doing. The difference between that and not normal aging, true memory loss, I don't remember how I got here. Or I believed I drove someplace when I rode with somebody. There's a difference. Okay, so what were the things that stood out to you all about the normal aging? What Tifa did. It's normal to forget certain things. Did she have a lot of things going on between the time she got up to get her coffee to the time she had a phone call? There were a lot of things mentioned in that phone call. The average person, normal memory, can keep 5 to 8 things in their working memory. So this is normal aging. So if I give you, I'm on the phone. So what was she getting details about? Meeting her at the mall. Where at the mall? Yeah, exactly. What else were they talking about? The chocolate she likes. What did you notice about her description of the white flaky stuff? Couldn't remember the name for coconut, but she talked around it. That's part of what we do too. And you know what you want to say, and someone will usually supply the word for you. Yeah, chocolate, that's right. What else was she asked to do? Call Margaret. What else was she asked to do? Bring the vacation pictures. Anybody notice what she did? Right. She was able to retrace her steps. That's an important piece. You can retrace your steps. You can kind of go, okay, I was doing this when she called, but she had a lot of information given to her in that phone call. What are the chances she's going to remember everything? Could she maybe forget to call Margaret to join them? Maybe forget the vacation pictures? Does it really matter? What about when she mentioned about the bathing suit? What did you notice she did? She almost started to tell her something about how she looked, but she stopped herself. She put her hand over the phone and said it out loud. Oh, she's getting fat. I'm not going to tell her. She has a filter. Yes. So what do you think happens when you move into not normal age, not normal memory? You lose your filter. So in humans, prefrontal cortex is the last thing to develop. In women, it's about 20 to 22 minutes, 25. This is why your rates for driving insurance are so much higher when you're younger men. You don't have this developed. You don't have the ability to see things from another person's perspective. Impulse control is not there yet. Last thing to develop, first thing to go when you develop a dementia. You start to develop these problems. So, and this is also part of normal aging. You start to say, but just stop yourself. You have the ability to. And that's something that filter is not as strong as it used to be, but it's still there. I can stop myself from saying something. When I filter's going on, I'm just going to say whatever. And that includes not just maybe saying something kind of ugly to somebody I would have never said before, saying something mean. I may have never cussed before in my life. I never said a bad word. Those bad words are stored over here on the right side of your brain. And they're kind of in those forbidden words. That filter that stops you from saying them, that's gone now. So you may have the judge's wife who never said a bad word in her life, all of a sudden drop the F-bomb in church. There's an example for you. Okay, so one of the questions, how do I prevent memory loss from happening? Really basic things. And they don't cost you anything. How about that? Staying physically active. What's good for your heart, good for your brain. Real simple. And you don't even have to go out and work out at the gym for hours. If you go for a walk, and I mean a walk, not just a kind of stroll down the avenue, up to 30 minutes, that's one of the best things you can do for your brain. Staying mentally engaged. You guys are doing that today. You're here because you want to keep learning. You want to stay engaged. Staying social. This is so key. And what the things that we're seeing, we don't have complete information yet, what isolation during the pandemic did for people. One of the things that I hear often from families is they were doing pretty well until the pandemic, and they had no interaction with people. And then we saw this really quick decline. Staying socially engaged is so important. And what that looks like is different for all of us. If I'm a hard introvert, I'm going to be better one-on-one. If I'm an extrovert, I'm going to be enjoying with a group of people. Every time you have a conversation with somebody, you are activating your brain. Those neurotransmitters are connecting. Spiritual involvement. This is, again, different for everybody. Some people enjoy being part of a faith community. Some people find it within themselves. Different for everyone. Minimizing risky behavior or dangerous. And that can cover a whole spectrum of things. I think you all know what a risky behavior is, right? And reducing anxiety and stress. As you know, my background is counseling, it was mentioned. I'm a firm believer that everybody somewhere in their life can benefit from counseling. Having an objective third party to just listen to you. And friends and family are wonderful, but they can't be objective. So if you find you're in a place of distress, reach out to a counselor, reach out to a licensed clinical social worker. It will help you tremendously. Yes. Yes, okay, thank you. Okay, so did everybody hear that? So the question is, proving to myself I'm still, that dealing with, I'm not able to do things the way I used to. It's part of normal aging. My body doesn't react the way it used to. My sense of balance may not be as good as it used to, but I still want to do those things because it means something to me. And how do you deal with it? That would be so there is a grieving that happens as we age. We're losing some abilities we used to be able to do. We don't see as well as we used to. We don't hear as well as we used to. And our bodies aren't quite as limber as they used to be. That's very frustrating. In our minds, we're still 25. Until we look in the mirror and it's like, oh no, you're not 25 anymore. So this is one of the hard things too. And that's such a good question. That would be a really good thing to talk to a counselor about, how to reconcile where I am in life when I want to still be able to do these things, but I know it's risky for me to be on a ladder because my balance is not as good as it used to be. Okay, you guys ready for the next video? Okay, this is not normal aging.
Make some of the stuff that you get off. It's gonna make it. Phone rings. Hello? Hey, sweetheart. Yeah. Who is this exactly? Betty who? Oh. Well, why didn't you say? Okay. Well, what do you want? Me today? Well, why did you wait till the last minute? I wish you'd tell me ahead of time. Well, I don't remember you talking about it at Bridge. Did you talk about it at Bridge? Well, you talk all the time at Bridge. Your mouth runs incessantly. Huh? Well, okay, I don't mean to be mean, but you just talk a lot. That's all. What? Oh, you want to meet at the mall? Okay, well, that's fine. Which end? 2 o'clock? Yeah. Macy's. Well, honey, I don't think there's a Macy's at that mall. Where's there a Macy's? No, that's a J.C. Penney. It's a J.C. Penney's. I have a card with them. I have a credit card with them. I know what it is. I buy things there. What do you mean they moved out? Shopped there not long ago. There's no way they moved out. Did they just close up? Well, good Lord. No, that's still, you sure? I think you're wrong. Well, fine. I'll meet you at that end. I know what you're talking about then. Huh? Inside the men's. Well, of course I know where inside the men's wear is, but you better get to the right store. You're not going to be there. Huh? All right. Well, fine. Whatever. What? Oh, they opened a chocolate store. Well, you know me. I love that. That's my favorite. What? Well, I'll have caramel. And you'll get the, oh, you like the kind of brown hairy ball and the brown stuff. What do you mean? What am I talking about? I'm talking about the brown hairy ball kind that you like. You like the brown hairy ball. Do you speak English? Honest to God, get what you want. I don't give a shit. I mean, whatever. I'll start arguing about this. Huh? Well, no, I'll call her and see if she wants to come. That's fine. What? The vacation pictures. Oh, about on the boat? Yeah, I'll bring them. Wait till you see yourself in that benzene. Well, honey, you look like a cow. No, I'm telling you, your butt cheek is hanging out so bad. I mean, it looks, I mean, you must have put on, what, 30 pounds? I mean, you're eating too many of the brown hairy ball things. That's what's going on. I mean, that's all I can tell you about it, because that's, you got to be sucking them down because the way it's coming. Well, if you don't like looking the way you look, you should do something about it. That's what I say. Well, listen, do you want to get together? Or are you going to get an attitude? Well, then I'll see you there too. That's fine. I don't know why you're so stirred up. You're the one eating. All right, then. Shit. I mean, I don't know what her problem is. The Lord, she gets an attitude. Now, let me think here. Oh. A dirty cup. A coffee cup. Now, I told my son that I was fairly sure that gypsies were coming in here at night and making coffee, drinking my coffee and leaving dirty dishes, because I've never left a dirty dish in my life. And here it sits, a dirty coffee cup, partially drunk out of. I'll guarantee this has their prominence all over it. And I better go check the bathroom, because sure, when they get in here and get that, they'll steal toilet paper too. They always steal toilet paper. Look at that. See, the roll's empty again. They come in here and he thinks I'm not nuts, because I saw that it's gone. Well, I'm going to go down to the corner store here and get some toilet paper, because there's nothing worse than constipation and you got to go and there's no toilet paper. You got to have some. So I go down to the corner store and I pick up a few things that I need, because I know there's some things I need. And I come back and I go to put them in the fridge and such. And there's another quart of milk in there. Well, I wonder who brought that by. I don't know when they brought that. I need it. Well, good. I can make use of it. It'll be fine. And let me go put this toilet paper up. You know, I'm not going to put it in here, because sure as hell they'll steal it just like they stole the other stuff. I'm going to go put this in the spare bedroom closet, because they won't think to look there. Okay, here we go. Oh my God. This is where they're keeping it until they can bring a truck to come pick it up. There's got to be 30 rolls right there. I'm going to hide it under the bed. They won't know where to look for it. At 10 minutes after 2, the telephone rings. Hello? Well, there. How are you? What do you mean, where am I? I'm at home. Where are you? Well, what are you doing at the mall? Well, if you wanted me to come to the mall, you should have called me. I can't read your mind. What do you mean you did? Who'd you talk to? No, I didn't talk to you. I don't remember if I talked to you. I haven't talked to you in, I don't know, a month or so. You did not call me. Maybe you called the other one. Listen, I mean, I hate saying this because I hate even bringing it up, but I think you best go see the doctor. Because I think you may have that dementia.
Okay, so that it ends with her telling her that she thinks she might have dementia. That the friend does, not her, the friend. Okay, so what did you notice that was different and not normal versus normal? She's paranoid, delusional, because she believes gypsies are coming in drinking her coffee and using her toilet and toilet paper. What else? No filter, angry. Yeah, hard to stay focused on a topic. What else? Anything else jump out at you? That was different than the first one, because it's essentially the same scene, somebody calling her to go someplace. Yeah, did she remember she in the first phone call, she said, well, I told you at Bridge. Did she remember that? Did she remember that she called her that same day? So her ability to hold on to information is not there anymore. Short-term memory. And so a landmark that's not there anymore, what could happen when if she did go to the mall? Get lost. She could drive past the mall because she didn't recognize that it was a Macy's she was supposed to go to. She could drive for hours. It does happen, and I've had patients. Right. Yeah. So if you think this doesn't, it really does happen. Yeah. And thank you for sharing that. You know, this happened with her husband. Yes, you have a question.
How does one differentiate between normal aging issues, not normal aging, and symptoms of other health issues like MS, related fog, and cognitive?
Great question. And actually, we're going to get to that a little bit, and I hope I'll answer your question. And let me know if that doesn't answer your question. So I really hate putting a lot of stuff on a screen like this, but it's effective to show you these are some of the challenges that people living with dementia face. How many have cared for somebody who refuses help? I am just fine. So 50% of people living with dementia have no insight. It's not denial, no insight. I am just fine. And who are you to tell me there's a problem? You're the one with the problem, not me. Anybody have that experience? Yeah, I had that with my mother. She had vascular dementia. And I'm going to go over a little bit about that as well. Okay, lots of challenges. That repetition, I can't hold on to information. Addressing in public, it happens. Seeing things in people that aren't there, hallucinations, paranoid, delusional thinking. So just some of the things. This is the dementia umbrella. And so dementia is an umbrella term. Just like the flu is, cancer, it's an umbrella term. There are a lot of forms and causes of dementia. And this is from the Alzheimer's Association. I disagree a little bit about the Alzheimer's. It is the most prevalent form. I think it's probably closer to 50 to 60% of all dementias are caused by Alzheimer's. How many people think dementia and Alzheimer's are separate things? Alzheimer's is a cause of dementia. Not all dementia is Alzheimer's. One of the definitions of dementia are cognitive changes that affect your ability to live your life on a day-to-day basis. It's not just memory. There is something when people have just short-term memory problems, it's called mild cognitive impairment, because I can develop strategies and ways to get around it, but it's not impacting my ability to live my life. So this is a short example. How many forms of causes of dementia do you think there might be out there? A lot? A lot? Anybody else? So it's different for everyone. If you've met one person living with dementia, you've met one person. We're all unique. We all got a unique DNA cocktail from our parents. Our life's journeys have all been different. So, and how you lived your life, what you've experienced makes you who you are. Same thing as being a care partner for somebody. There can be, I think, this is the way I prefer to think it. It's more of a risk factor. More with dementia of the Alzheimer's type is what we think right now. The knowledge about dementia changes all the time. I have had identical twins. One developed dementia, one did not. So lifestyle does play a role. In this particular case, they were separated at a very young age, adopted into different families. The one that's developed cognitive issues had a very different life than the one who did not develop it. So our environment does play a role. What triggers it in one person and not another, we don't know. So think of it as a risk factor. And what we talked about earlier, how do you minimize those risk factors? Yes. So dementia is not part of normal aging. So we talk about normal age-related memory loss. And so people get very confused. The first time you forget where you left your keys, you forget somebody's name. Like Tipa said, we're all worried about this. We all get upset. Am I developing a dementia? And we're going to talk a little bit about what do you do about that. So think of dementia. What happens in dementia? The wiring in the brain goes on the fritz and starts to die. And the neurotransmitters can't connect the way they used to. Different forms of dementia have different symptoms. So when you're getting a diagnostic impression, it's what is the presentation in that person that we see. So we all have strengths and weaknesses. Some of us are really good with names. Some people are really good with faces, but not names. You know them, but you can't think of their name. We're all different. We're all wired differently. So that's why I always like people to be a little bit careful about saying this is this. We have to take into account who that person is as an individual. I'm going to go back and use my mother. My mother never had a filter, ever. Said whatever she thought when she thought it. Always got stories. When you told her something, she always got the details confused. My entire life. She was always losing things. Always would leave things behind. I remember being 5 years old, running back into a store to get her sunglasses. So when she developed dementia, how easy do you think it was for us to figure out there was something different? What we look for is what's different. Some people are just never had that filter. It's a little bit harder to tell something's going on. Okay, so these are two individuals. It's about the same age, gender, education. This is a healthy brain. And because Alzheimer's is the more prevalent dementia that's out there, there's a little bit more that will demonstrate with that. What do you notice? Smaller color. By the end, this brain is going to be a third of the size of of a normal brain. Right, you have much more. So how do you think neurotransmitters connect when you have these distances? Like they're shouting over a chasm to be heard. Sure.
And they couldn't read the first one or the fourth one over.
The fourth one over. So genetic syndromes, metabolic diseases, alcohol related. If people have seriously abused alcohol, you can develop a form of dementia from that. Drugs, toxins, white matter disease, that has more to do with the vascular piece. Depression can be a risk factor. Mental conditions. So a UTI, so there's something called delirium, and you have to distinguish. UTIs can cause delirium. Anytime somebody has a quick overnight change, there's something else going on usually. And so it could be there's been a stroke that could have caused that change. But dehydration, UTIs, sodium deficiencies, those can look very much like I've had a really quick change overnight. You need to get to a physician and be seen right away. Okay, that's a good question. So are we at our best when we're really sick? No. How about when we're really stressed? Yeah. Anybody know why we don't think well when we're stressed? Well, what happens is cortisol levels go up in your brain and interfere with your ability to think straight. And one way, if you find yourself getting really stressed and tense, there's a way to bring your cortisol level down. And if you feel comfortable, would you stand up and we're going to practice this? If you're comfortable, you can do it seated as well. I want everybody to take in a deep breath. And again, you can sit down. When you take a deep breath, it lowers the cortisol levels in your brain. It's a really simple thing. And it works in every area of your life. When you start feeling this, take a deep breath. Okay, we looked at this brain. Okay, this is a really famous slide from UCLA. And the top row is, so normal brain, early Alzheimer's, late Alzheimer's. This is an 18-month-old child. This is if you took the top of my head off and you look straight down into it. What do you notice in the normal versus the early Alzheimer's? What looks different? The purple part, right? It kind of goes away.
What are
Those are the
colors representing?
So the different colors represent the speed your brain is working at. So with a PET scan, they put sugar into your brain, and they give you things to do. And this is how you react to those tasks, how quickly you can do them. And the bottom row is like, somebody's taken the top of my head and sliced it down a diagonal. What do you notice between the late Alzheimer's and the child, the 18-month-old child? Are they pretty similar? Well, yeah, you have shrinkage. What about the function? How much activity are you seeing? You see much less activity. Do we say of an 18-month-old child, oh, too bad they can't do that? Well, we do that for an adult. So the purple is like I'm at a stop sign. And see how much fewer there is in this one. And then you get to this one. Let's see. This is the amygdala. This is part of the primitive brain. And you see it's a little bit more stimulated in early disease, in the early Alzheimer's process. But these are very similar. I find this is really helpful when I'm working with families so they can see when we talk about activity, to get a better understanding. This is how the brain is functioning right now. The difference with this brain is it's going to continue to develop. Okay, so what's circled to the bottom, that's the occipital lobe. That's in the back of your head. So there are changes that happen with vision and with hearing with dementia. Okay, so I'm mentioning the 5 senses. The primary way all humans prefer to take in data is visually, then auditory, and then touch. What becomes important is how primarily vision and hearing change with this. So I want everybody, do you guys mind standing again? If you can, if you can't stand, it's okay. All right. Make sure you're far enough away from your neighbor. I want you to put your arms out like this. How many people can see their fingers wiggling? They are wiggling, but can you see them? Bring them in until you can actually see your fingers. Okay. If I'm 18, 20 years old, I can see, and I'm not stressed, I can see my fingers wiggling. Part of normal aging, once you bring it in to about here, 75, so this is your visual field at 18 to 20. I want you to do this. This is your visual field. Okay, bring your arms in a little bit, about 75. This is your field. It's still a pretty good field, but it's not as good as it used to be. Now I want you to put their arms out straight for me like this. Bring them up to your eyes. Early stage dementia, this is your visual field. And as it progresses, at the end, it's monocular. Okay, you guys can sit down now. So why is this? It's important for us to understand how that other person's perceiving the world. Even in early stage, I miss 1 out of every 4 words that's spoken to me. And it's not a hearing problem, it's a processing problem. Yes.
And it's the visual field is not that it's caused by your eyes, by the eyes nerve, it's caused.
It's by the wiring in the brain going. Because think about it, 2 eyes, a lot of complicated wiring that goes here, has to coordinate everything and goes all the way to the back of your head. That's a long way to go. So again, dementia changes everything over time. It's not something that person can control. Dementia, it's not the same for everybody. It's not a mental health issue. It is a medical condition. It's real and it's hard at times for the person living with and the person supporting them. Okay, little brief, normal aging. Think about the role play that you saw. What jumps out at you? So, not normal. You're not able to think the same. So one of the things that becomes affected is executive function. And executive function is my ability to problem solve, make decisions, plan, initiate a task, know all the steps necessary for that task, follow it through, complete the task, and move on. That starts to become affected. I can't think the same way. I can't plan the same way I used to. I can't make decisions. What do you think that does? It puts me at risk for being taken advantage of, for being scammed. Okay. So everybody had a chance to take a look at this? Okay. Any questions about that? I'm sorry, it's supposed to be word finding. Yeah, just find it. And so, coming up with that word, it happens to all of us. It's part of normal aging. The difference is when I can't think, when I'm describing coconut as brown, hairy ball thing, that's the difference. Saying, that white flaky stuff in the coconut. We all knew what you meant. Chocolate covered coconut. Anything else on this? Okay. So far, so good? All right. So somebody was asking a little earlier about some things that can look like dementia. Delirium, that's that rapid change in thinking and alertness. Seeking, and that's why I said you go get medical help immediately. Depression, that's chronic, that's untreated, is a risk factor. Yes.
Someone asked, can you get similar changes, temporary or permanent, from prescription drugs?
Yes, and we're going to talk about that. I love it when you guys tee me up. Get me ready. Okay. How many of you know that depression in males, for the most part, do you know what usually looks like, depression in most males? Anger. So a lot of times somebody can be really depressed and it's going to come out as anger. And that fools us because we just think they're ticked off about everything. So getting these things treated is really important. But again, risk factors. Depression, so that you can't think, you can't remember, you lose function. Mood swings, personality changes in sleep. Delirium, that's what changes. People with delirium can have hallucinations and delusions. And it's due sometimes to infection or toxicity, taking a medication, mixing medications. A lot of different drugs can cause problems. So the other thing is a lot of times, and this is especially in older adults, these drugs have a different effect. How many of you are aware there's something called the Beers list? Beers list. It's named for a guy named Beers, not the beverage. It is a list of medication, both prescription and over the counter. If you are 65 and older, you are best to avoid this medication. The primary one for over the counter is Benadryl. All those PM drugs, Tylenol PM, they're all loaded with Benadryl. It's not your friend. It's going to make you feel real out of it, real confused the next day. And if you've taken it, how many have you woken up and you just had a really hard time waking up and kind of getting with it? So you can look it up online, the Beers list. It changes. They just updated it this year. Beers, B-E-E-R-S. Yes. Great. how do I feel about the drugs like Prevagen and Nariva and all those? Okay, here's my answer. They're not going to hurt you. They're going to hurt your pocketbook. So the thing to know about supplements that most people don't realize, they are not controlled by the FDA. You can buy a supplement that says it has this in it. It may not even have that ingredient. You really have to be careful. Talk to your pharmacist and ask, what is a good brand? One of the brands that I am very comfortable saying to get is Nature Made. They really do a pretty good job of keeping consistent in the way they manufacture. Many companies are not consistent in the way they manufacture their supplements. So you really have to be very careful. I had somebody come in once that was on like 42 different supplements. Nobody needs to be on 42 supplements. The things that for older adults are most important are making sure you're getting enough B12 vitamin. When B12 levels are low, it can cause problems with your thinking. It can make you feel fatigued. It can make you a fall risk. Your balance is not going to be as good. And in some people, it actually causes behavior problems. And that can happen in younger people as well. It's not just older adults. B12 levels being low is really important, really has more of an effect than people think it does. So making sure that your physician's checking your B12 levels. The other thing to know about that, you know those ranges that you get that says, oh, this is within the normal range? Those ranges are based on people about 25 to 55. Older adults, the ranges are a little bit different. So for example, an older adult, I want your B12 level to be about a 500. That's for optimal brain health. For B12, in your lab results, it should be about 500 for optimal brain health. For vitamin D, again, one of those building blocks for cognition, it should be about 50. Okay, so you've noticed changes. The next normal question after this is, so what do? We notice changes. Get an assessment. Get a diagnosis from a medical doctor. Please stay away from the internet. If you do have to go on and look for medical information, go to the Cleveland Clinic or the Mayo Clinic. And if you guys want some good websites to go to for information, contact me, let me know. Okay. So suppose you suspect something's going on with somebody you care about. Be their advocate. Be supportive, be curious. What's really going on here? Maybe it's a medication issue. I had somebody, I've been doing this about 11 years. And one of the earliest patients that I saw, it was a medication. And once he got weaned off this particular drug, and it took a while, he was perfectly normal. He remains normal to this day. So I cannot emphasize the importance of getting a really good comprehensive assessment. So when you're getting a diagnosis, what steps do you want to take? A complete physical, medical, and psychological history. A good history for the person and the family of the problem. A thorough physical, neurological, and cardiac exam with blood work. The blood work, so in our clinic, and so I work in two different clinics. I work in the comprehensive geriatric assessment clinic. I also am in a neurology practice down in Hampton with Riverside 1 day a week in a memory care clinic. And so these are very similar in overlap in what they do. Blood work, the labs are really important. What we look for is a complete metabolic panel. Is there a metabolic issue happening? Complete blood count. Do we see any kind of infection that could be causing a problem? The B12 we've talked about. Vitamin D is another one. Thyroid. Also, making sure that you have a lipid panel to take a look at the cholesterol levels because we want to manage that risk factor. Serum folate is a B vitamin that's also connected with cognition. So those are the labs that we're mostly interested in. Also getting a head scan. So what does the head scan do? Some people cannot have a MRI. If you have any metal in your body, you have a pacemaker. So CT is the next best thing. There are kind of 4 acute findings that we're looking for. Do we see extra fluid on the brain? Do we see any evidence of stroke or little strokes? Do we see a tumor or do we see a bleed? Those are acute findings. Now, the non-acute findings, it can also help inform our diagnostic impressions. How much shrinkage of the brain do we see? Do we see global shrinkage? Do we see more shrinkage than we would expect for somebody of that age? And education does play a role in this. Do we see more shrinkage in one area of the brain than the other? Those can help give us cues. No one thing determines a diagnosis. It's a combination of pulling all these things together and figuring out what it is and what it isn't. Any questions about this so far? Pretty clear? Okay. And a complete medication review. So again, I'm based in Williamsburg at the Martha W. Goodson Center, and we used to be the Center for Excellence in Aging and Lifelong Health. Comprehensive geriatric assessment, our team, I'm part of the team. We have a geriatrician. Geriatrician's important to understand older adults and how their bodies function and what's normal versus not normal. What's normal in a 25-year-old is not going to be necessarily normal in a 70, 75-year-old. Things change. A nurse, and we have a clinical pharmacist who specializes in geriatrics and understanding how, again, 65 and older, your body is going to process that medication different than somebody who's 25, 30, 40, 55. And it's not uncommon for us to find there is a medication there that's causing an issue. The other thing that they do is so we're consultative only what we do. We send our recommendations back to the primary care provider, the treating physician, to say, you may want to think about changing this medication to something else. One of the things, again, part of normal aging, our kidneys aren't as efficient as they used to be. So one of the things that our pharmacist is looking at is those labs that identify, is this having an adverse impact on your kidney? Because your kidneys are not going to be as efficient. Is there a better medication that you could be taking that will do the same? In the imaging study we talked about, PET scans are really hard to come by. They're just really expensive. So unless you're part of a study, a clinical trial, it's really hard to get a PET scan approved. They're thousands of dollars. And neuropsychological testing. So some of you live in places where you have to do an annual cognitive screen. Okay. So you may score a little bit different on that screen than you did before. What the neuropsychological testing is, it takes those elements on that cognitive screen and goes into more depth. And what it helps tease out is how much anxiety and depression might be playing a role. If you are in chronic pain, could that be having an effect on your ability to process? If you're in pain, how well do you think you think? It makes a big difference. So if that pain is not being treated, I don't know about y'all, but I don't feel good. I don't think real well. So the neuropsychological testing, so that gives us all these things, give us a good baseline for where you are at that moment in time. The thing about the cognitive screen is that is where you are at that moment in time. It's short and it's brief. The one that we prefer to use is the Montreal Cognitive Assessment, or the MoCA. It's evidence-based. It's very good. I've been giving the MoCA for like 11 years now, so I feel very comfortable with it and interpreting it. Okay. Getting some counseling during the process can be helpful. Just someone to talk to kind of help navigate, help you understand why things are doing. How many people's doctors really explain to them well what they're doing and why they're doing it? Not so much. Depends on the physician. Some physicians are better than others. But I think oftentimes people go, I was sent for an MRI. I don't know why I'm having an MRI done. I don't know why I'm having these labs done. You know? Yeah. So yeah. I'll tell you why you're having those labs done in that and why we're doing the neuropsychological testing. Okay. So just having somebody to talk throughout the process when you're undergoing something like this is really important. Okay. And this is what do you do if somebody, we're looking at, it's not normal aging. There's something going on. Are there support groups for people that are living with dementia? Right. Yeah, that's a good question. There are so many support groups out there. If anybody needs a list of support groups, I have it in my office. I'm happy to email it to you. But there's a lot of things that are out, a lot of support groups. Some people are not comfortable going to it in person, and there are things available online as well that you can participate virtually if you're not comfortable getting to another location or being with people. Everybody's different in what their needs are. So the person, again, when we're talking about things, it's how we frame it. I'm a person who's living, so you live with heart disease, you live with diabetes. People don't usually say they have diabetes, or they might say they are diabetic, but does living with a chronic illness define who you are as a person? No. So my preferred term is someone's living with dementia, because it does not define who they are. They're still a person. They are not a diagnosis. And I also, so from my studies and what I've done, it's not an optimal thing to have. It's not a chronic disease that you want to develop, but you can live well with it. And that's kind of what our goal is. How do we give that person living with dementia that best quality of life? And you, as their care partner or person in their life that's supporting them, how do we give you that good quality of life as well? This is our goal. All right. And I am almost done. And I thank you guys, because I think I'm going a little bit over. If you are interested in getting a comprehensive assessment, you can contact the Martha W. Goodson Center. We've talked about the team. You can find Teepa Snow. She's got a great website. She's on YouTube. If you do TikTok, you can find her everywhere. She's amazing. Thank you. You guys were great.